An issue of public health now that we should focus on. In an effort to protect children from the ongoing measles outbreak and provide a booster dose of the Measles-Rubella to children between 6 months and under 15 years old, the Gauteng Department of Health will on Tuesday launch Measles-Rubella mass vaccination campaign at the Steve Biko Primary School in Orange Farm in Johannesburg. The health district that is Joburg will be a focus with MEC for Health and Wellness, Nomantu Nkomo-Ralehoko, leading the launch under the theme, quote, lifelong protection against measles and rubella disease. The campaign will run from the 4th of August to the 12th of November 2025 and target over 4 million children in schools, crèches and communities across all 5 health districts in the province. The campaign comes as Gauteng continues to respond to a persistent measles outbreak that has affected all districts since 2022, with over 370 confirmed cases recorded since January 2025. For more on this, I'm joined now by Mashaole Makwela, who is Surveillance Manager at the Gauteng Department of Health. Good afternoon, and thank you for your time. Talk to me about the story of the epidemiological week of the week 1 up to week 18. What picture is emerging in terms of the measles outbreak, and how does it compare with the baseline before the current outbreak?
All right. Thank you so much to listen, your viewers. Measles outbreak has been on for quite some time. As you had indicated, since 2022, we had measles outbreaks in the country. So the pattern this year was just consistent with what has been happening in previous years. So from week 1 up to now, to date, we have 372 cases to be precise. And these cases are spreading from all the districts, as you have indicated. So the epidemiology is such that the cases are spread throughout the whole year. But now in June, as is typical with measles, because at times you have it seasonal. So the cases started to spike, and that is the picture that we are seeing that has necessitated us to really intervene with these campaigns.
How does it compare with the baseline? You say that we have outbreaks from time to time, but this is a vaccine preventable disease, is it not?
Yeah, no, true. Last year around this time, last year for the whole year, we had about 311 cases for the entire year. So you can already tell that we are months, just before December, and we're already at 370 cases. So there is an increase compared with other years. As we look back in 2022 to 2025, definitely an increase. But the picture in context, you must look at what is happening also globally. If you look at countries, there are currently outbreaks of measles. In America, numbers have been 11 times more compared to the year 2024 year. So there is a, if you have to put into context.
To do we pin that down? That increase not only domestically but globally. How do we explain it? Was there a sense of a loss of momentum in terms of vaccinations over the years, last few years in particular?
Look, it's down to a couple of reasons. One of the reasons is that for whatever reasons, either or religious reasons, cultural reasons, or personal reasons. So that has been what we were battling with, especially post the COVID era. There was question marks around the vaccines. So there's been a bit of hesitancy in the uptake of the vaccination in general, based on those reasons that I've indicated. And I mean, if you're looking at Gauteng, for one, it's one unique province that it's an economic hub, and you have got international visitors that are coming through into the province for whatever reason. Some of these people that are coming in, they have not really been fully immunized, and that in itself, in a highly densely populated province such as Gauteng, you tend to have pockets of unvaccinated communities, and there is a mutation of case, or there is a spread of case, then you do have an outbreak which would be similar to what we are having currently.
Your target is to vaccinate some 4 million school children, but you're starting in Orange Farm, and is there a specific reason why you're starting there? Does Orange Farm typify a kind of area where you would want to go in and target based on what you're seeing in terms of the epidemiology?
No, the three metros in Gauteng province have, all affected, and includes even, Johannesburg, and we selected the Orange Farm School purely because it's also in one of the districts that has been affected. So that's why we are launching. The launch is just to really say that we are in a campaign. People need to be aware. So it does not really say that there are more cases in Orange Farm than in any other place. It's just purely in the fact that it's one of the 3 districts that really has been affected with the measles outbreak, and that's where we have decided to really launch and create awareness, when it comes to measles vaccinations.
And lastly, talk to us about the logistics. How will it all work in terms of the vaccination involving school children? What do parents do, for example, to facilitate their child is not left out?
Okay, so this is a massive undertaking. So what we are doing is that the campaign is going to really be a mass campaign. So in any mass campaign, you would have, multiple points of vaccinations. That will include your public areas such as your parks, your crèches, your clinics, your malls. It also includes the schools where the vast majority of our targets will be in. And so the consent form has been issued out to schools so that the parents can sign and bring them back. And we appeal to parents to really complete the forms and bring them back so that their children really get vaccinated. And I must indicate it is an opportunity, not only because we are dealing with the containment of measles outbreak. We have introduced rubella vaccine in 2024. So the vast majority of children within that age group would have not received that vaccine. So it is an opportunity for those children to get vaccinated with that dose of the Measles-Rubella vaccine. So we are trying to really ensure that children are, protected from all these severe illnesses that might result if not vaccinated or fully protected from measles and rubella.
All right, thank you for that. That's Mashaole Makwela, who is Surveillance Manager at the Gauteng Department of Health. An important call to action there. Do look out for that mass vaccination undertaking by the Department of Health for measles and rubella, and it will be focusing mainly among children of school-going age from 6 months, and the target is 4 million children that are being targeted. So do look out and take that step to be a part of it.